Podcast Bites.
Hello, Trail Seeker, and welcome to another exciting episode of the Learn True Health podcast. You're going to love today's interview with Dr. Will Cole, who is a functional medicine expert. He shares some amazing information. So we look at the MD allopathic model, and it is designed the way it was, even if you look at the history of allopathic medicine, it is about protecting the interests of big pharma, protecting the interests of drug-based medicine. And functional medicine is coming along, and functional medicine isn't rejecting drugs, but it's looking at how we can best serve the person and use the best tool that's needed. Oftentimes not a drug, but if there's a drug that's needed, then fine. But that is still very threatening to the standard allopathic medical system, which says that there's no relationship between diet and health. You're looking to help people get healthy. So have you come up against any friction as you're practicing functional medicine? Have you come up against friction from the allopathic mainstream world?
Generally speaking, no. I think that the what I'm putting out into the world and what I want to continue to put out in this world is we should be all on the side of the person that's dealing with the health issue and our collective health as a society. So I would say oftentimes, to use a spiritual principle, what you resist persists. So I feel like my whole ethos of what I'm putting out there is let's come together of how can we make people feel great. And I'm not anti-medication, like you said. My job is to find what's your most effective option that causes you the least amount of side effects. And certainly some people are alive because of medications. And there are life-saving advancements in medications and life-saving surgical interventions. My question is, what is our most effective option that causes you the least amount of side effects if a medication is the only thing that's given, and then yet there are more conservative, safer, little to no, most of the time, no side effects of getting healthy and using food as medicine. This is not radical stuff. This is not, things that should be scary to the status quo. If anything, we would live a more vibrant, productive, healthy, long life. And yes, on one level, it looks like if someone's off of medications, that's not good for the pharmaceutical industry. So on one level, I guess it could be threatening to the bottom line. But in an industry that's depending on someone being sick, we have to change the paradigm of how we're even relating to that industry, because it shouldn't be just sick care. It should be, let's come together to get healthy. This is why people get into healthcare. Every doctor takes the Hippocratic Oath. Well, let's start doing that. And really just first do no harm. Let's think about that. He also, Hippocrates said, let food be thy medicine and medicine thy food. And he also said all disease begins in the gut. So really functional medicine isn't new at all. It's actually just Hippocratic healthcare. Back to the original, but we're using the amazing advancements of science that we know today as far as diagnostic testing to find these underlying facets like microbiome health and genetics and hormone imbalances, to be as evidence-based we can, but still stick to our Hippocratic Oath. That's all functional medicine is. So I don't get a lot of blowback or negativity from mainstream medicine. I think because I'm just pointing out, let's come together. There's a place for medications. There's certainly a place for surgery. There's a place for functional medicine. There's enough people out there that need help. And this should not be us threatening them, and this should not be us being threatened by them. So I would say that's my position on it. And ultimately, too, I think that, with that said, there are still people that are negative. I see it once in a while on Twitter. Twitter is like the armpit of social media. I love Twitter as far as like getting news. Like I love like Twitter feeds and things that are trending. I think it's so great. But the amount of like dogmatic, like dark bullying and like is like so disturbing on a deep level, on so many levels. And it's not good. And I think that's, honestly, not to get too political, but I think that's why the president knows that. He puts out a tweet and it like feeds this negativity on social media. And that's just one aspect of it. He didn't start the negativity. It's been there for years. But it is like this social media platform that's amazing, but also it's this weird dichotomy. It's great data, like it's information, like really easy to read, and it's trending and it connects people, but it's also like these armies of trolls that are mean. They're really nasty and mean, and there's no logical. You can't even engage in it with them because there's no. So when I see it, I just normally just put it away. But that's few and far between. The overwhelming majority of, I mean, look, the Cleveland Clinic has a functional medicine health center now.
Mm-hmm.
I mean, you can't get more mainstream than the Cleveland Clinic and the amazing advancements in technology and healthcare. They have a functional medicine center. So for people that are still behind the times and saying that somehow functional medicine is quackery or what we're talking about is just is nonsense, the reality is if the Cleveland Clinic is realizing there's a place for functional medicine, why aren't you? How evidence based are you? Are you going against what the Cleveland Clinic is saying? And other hospitals too, and other, not just the Cleveland Clinic, but a lot of mainstream are bringing in integrative and functional medicine, and that's exactly what we've been talking about for the past 10 years. Myself and many other people in functional medicine have been. So this is nothing new. I think they're just catching on because we have to do something different to see something different. And you can't look at the level of chronic disease we see as a society and the amount of money we're spending on it. We spend more on healthcare than the next 10 top spending countries combined, yet we have the shortest lifespan of all industrialized nations, yet we have the most disease. The rate of maternal death and infant death is abysmal compared to other industrialized nations, yet we have all this at our fingertips. Well, we have to start looking at how can we be more effective and cause people at least a lower amount of side effects. So let's just be open. Let's not be so when healthcare or medicine becomes a religion, you're exactly like the religious radicals, but your religion's medicine. Your God is medicine, and you're putting your false God before people, and that's a sad place to be in. And that's where a lot of these people that are trolls, they are. Their God is their beliefs, and they're radicalized to the point of treating people horribly. And that's a sad place of to be at. But that's, to me, it has nothing to do with me. It says more about them than me.
There is no box. You create that box in your mind, or someone else creates it for you.